Good evening everyone. I am Dr. Mohan Gayen, demonstrator in the Community Medicine Department at RGKMC Medical College, Kolkata. Today we are going to discuss all the MCQs that are asked in the semester papers across various medical colleges in West Bengal. There are some questions which are not the direct semester questions, but they are very much important and could likely appear in the upcoming exam. This session aims to aid your preparation for the upcoming third Prof Part-1 exam and PG entrance exams also by thoroughly discussing each question along with explanations. I encourage all of you to participate actively in this session by providing your answers in the comment box. Before beginning this session, I would like to ask you a question. Can you compare this mega discussion session with a well-known campaign? Please listen the question carefully. Can you compare this mega discussion session with a well-known campaign? Please let me know in the comment box. Yes, right. Pulse polio immunization campaign. All the students will be sensitized at the same time with the wild semester questions, just like the wild polio virus. Why semester is wild? You know better than me. Alright, let's come to the main topic. Read the first question carefully. Haddon's matrix can be used for all except options are cyber attacks, terrorist attacks, earthquakes, RTA. Usually Haddon matrix is used for RTA. So here the question is Haddon's matrix can be used for all except. I will show you a picture. This is the picture of Haddon's matrix. Haddon's matrix is a brainstorming tool that combines the epidemiological triad: agent, host and environment, and levels of prevention. So it combines the epidemiological triad and levels of prevention. It was developed by William Haddon in 1970. Please see the Haddon's matrix carefully. So Haddon's matrix can be used for RTA, earthquakes and for terrorist attacks. So the right answer is cyber attacks, because Haddon matrix cannot be used for cyber attacks. Please come to the second question. Diagram to correlate two quantitative data. Options are histogram, scatter diagram, line diagram and frequency curve. Please try to answer the question. Only write the options in the comment box. Diagram to correlate two quantitative data is scatter diagram. Okay. Come to the third question. A 10-year-old child presents with a mental age of 3. How would you categorize this child? So first of all, you have to calculate the IQ. We all know IQ means mental age by chronological age into 100. So here mental age is 3 and chronological age is 10. So 3 by 10 into 100, that is 30. So in which category the child will be classified or categorized? Please see the chart. Idiot means IQ 0 to 24 and imbecile means 25 to 49. Here the IQ of the child is 30. So the child is imbecile. Okay. Next question. All of the following are notifiable diseases under Factory Act except options are toxic anemia, asbestosis, bagasosis and biocinosis. So here asbestosis, bagasosis and biocinosis all are occupational diseases. But here the question is about the notifiable diseases. Please see the image. There are 29 diseases which are notifiable according to the Factory Act. Here the last option is toxic nephritis and other options are toxic anemia, asbestosis, biocinosis, but there is no bagasosis in the list. Is not it? So the right answer is bagasosis, which is not a notifiable disease, which is caused by sugarcane dust. Come to the next question. If effective treatment of cancer is initiated and other factors remain same, then incidence will increase, incidence will decrease, prevalence will increase, prevalence will decrease. If effective treatment for cancer is initiated and other factors remains constant, so the prevalence, that is prevalence means new plus old cases, so the prevalence of cancer is likely to decrease over time because number of old cases will be decreased, but incidence or the number of new cases of cancer will remain same. So the right answer is prevalence will decrease over time. Come to question number 6. The Pearl index of a contraceptive, if out of 20 women 8 got pregnant in 24 months. So Pearl index is the measure of contraceptive failure. So how to calculate it? Please try to calculate and answer the question. I am showing you the formula. Pearl index equal to number of pregnancies into 1200, that is 100 women years by number of women in number of months, that means months of exposure. So put the values. Number of accidental pregnancies is 8 into 1200 by number of women 20 into number of months 24. So the right answer is 20. That is option number A. Option A. Read the next question. International agency funding for sanitary latrine construction in India is. It is a straightforward question. The right answer is option number C. That is Ford Foundation. The Ford Foundation is an American private foundation with the stated goal of advancing human welfare. It was established in the year of 1936 by Herschel Ford and his father Henry Ford. Come to the next question. Scheme related to prevention of child trafficking is. Read the options carefully. All the options are alike. I am showing you some images. Ujala is related to LED bulb. Ujwala is related to LPG cylinder, and Ujjawala, that is related to child trafficking. So carefully notice the spelling. So the right answer is Ujjawala. That is option D. Come to the question number 9. Gather approach is used for counseling, breaking bad news, death sentence hearing, forecasting a natural disaster. So gather approach is used for counseling. Full form of gather. See the chart. G for greet, A for ask, T for tell, H for help, E for explain, and R for return. So gather approach is used for counseling. Next question. All of the following specialist doctors are present in a CHC, that is Community Health Center, except pediatrician, gynecologist, ophthalmologist, and otorhinolaryngologist, that is ENT doctor. So who is not present in CHC or not mandatory to be present in the CHC? Right option is ENT doctors. As per minimum norms, CHC is required to be manned by 4 medical specialists, that is general surgeon, physician, obs-gyne gynae doctors, and pediatrician. Other medical officers are ophthalmologist, anesthetist, public health program manager, dental surgeon, and Ayush doctor. So here the right answer is otorhinolaryngologist. Come to the next question. National Institute of Epidemiology is located in Mumbai, New Delhi, Chennai, Kolkata. Right answer is Chennai. In safe strategy for trachoma control, F indicates which level of prevention. So full form of SAFE. S for surgery, A for antibiotics, F for facial hygiene, E for environmental cleanliness. So surgery means trichiasis and entropion correction surgery, that is tertiary prevention. And antibiotics, which antibiotics are given? Oral azithromycin and topical 1% tetracycline, that is secondary level of prevention. And F for facial hygiene. So facial hygiene is maintenance of facial hygiene is primary prevention. And E for environmental cleanliness, that is primordial prevention. Come to the next question. So answer of the previous question, which one is? F for facial hygiene, that is primary prevention. So option B is the correct answer. Question number 13. Recently, NP-CDCS has been changed to NP-NCD. The new diseases included in the NP-NCD is NP-NCD means National Program for Non-Communicable Diseases. So the new diseases included, which are the new diseases? New diseases are fatty liver diseases, CKD, that is chronic kidney disease, asthma and COPD, and ST, elevation myocardial infarction. So here the correct option is asthma and COPD. But the other options are alcoholic fatty liver disease. That is not true, because non-alcoholic fatty liver disease is the correct answer. So new diseases included is asthma and COPD. So option A is the correct answer. Come to the next question. Please read the question carefully. One of your colleagues visited the community medicine department for consultation after experiencing a needle-stick injury while attending to a hepatitis B positive patient. Serology was recommended and the results showed anti-HBs antibody value of 100 and a negative HBs antigen. What is the next step in the management? Please try to answer the question. Here the titer is more than 10 and HBs antigen is negative. So the person is protected against hepatitis B. Probably this titer was due to the previous vaccination. So the right answer is no treatment required. Come to question number 15. Current recommendation by WHO to treat possibacillary leprosy with a combination of. So answer the question. As per the current recommendation by WHO, both possy and multibacillary leprosy are treated with the combination of 3 drugs, that's are clofazimine, dapsone and rifampicin. Only there is difference in the duration of treatment. So 6 months for possibacillary and 12 months for multibacillary leprosy. So the right answer is option A, 3 drugs for 6 months. Next question. Duration of validity of 17D vaccine is 1 year, 5 years, 10 years, lifetime. So 17D vaccine is yellow fever vaccine, and the certificate for yellow fever vaccine is valid for lifetime beginning from 10 days after vaccination. So the right answer is option D, that is lifetime. Next question. Who is among the following will be the most appropriate contraceptive for a mother with an 18 months old breastfeeding child? Combined OCP, progesterone only pill, condom, tubectomy. So most appropriate will be combined OCP. During exclusive breastfeeding period, combined OCP is contraindicated, but after that period, combined OCP will be the most appropriate option. So here the age of the child is 18 months. So combined OCP will be the best option among these.